The health system costs of cancer and equitable access to effective treatment for future patient needs are among the most important health policy and research topics in Australia. As the patient base grows and treatment options become increasingly complex, the cost burden will increase significantly, requiring forward planning based on accurate, evidence-based forecasting. Currently, health technology assessment agencies rely on the population estimates provided by sponsors, resulting in significant heterogeneity in estimates of eligible populations. Decisions are therefore not informed by independent projected patient population data to support a standardized approach to application assessment. In order to address this gap, Monash University, the Daffodil Centre and the University of Melbourne were separately awarded grant funding in 2020 through the Medical Research Future Fund. The aim of the three projects is to develop estimates of future cancer burden in Australia to support decision-making in the allocation of health resources. This presentation gives an overview of the Daffodil Centre's project, Cancer Patient Population Projections.
Hello, my name is Karen Cadfell. I'm Professor and Director of the Daffodil Centre at Cancer Council New South Wales and the University of Sydney. And I'm also one of the chief investigators on Cancer P, or Cancer Patient Population Projections. Along with our research team today, I'm delighted to share with you some of the information about our project, which aims to project the incidence, mortality, and prevalence of cancer in Australia now and into the future. And we are very focused on a few key cancer types, including cancers of the breast, colorectum, and lung, as well as multiple myeloma, melanoma, and also we're looking at the burden of cancers related to pan-tumour biomarkers. So our project work is spanning 4 years. We started in 2020 and we're due to finish in June 2024. And over this period, we've been further developing or refining our existing platform for modelling cancer now and into the future, and that's called Policy One. So for each nominated cancer type, tumour type, or tumour biomarker, we'll actually be looking at patient population projections for patients and the burden of disease over the next 5 years with a rolling 5-year window. And we'll be delivering our first results to the department in June 2023.
Let's take you through our Policy One platform. At the Daffodil Centre, we are constantly analyzing administrative data, undertaking evidence reviews, and seeking expert advice to accumulate data to inform our models. We integrate the data we collect on the natural history of disease, trends and projections, treatment pathways, economic factors, and associated interventions using our Policy One platform. After all this data has been used to parameterize the model, we can use this calibrated and validated platform to predict the future burden of cancer.
There are many examples of our Policy One platform impacting national policy. With Policy One Bowel, we estimated that improvements in participation in the National Bowel Cancer Screening Program could save almost 84,000 lives from 2015 to 2040, and we illustrated the cost-effectiveness of a mass media campaign to improve participation. These both contributed to a $10 million investment from the federal government in a national mass media campaign. With Policy One Cervix, our cost-effectiveness analysis underpinned the decision to transition to primary HPV screening with partial genotyping in the Australian National Cervical Screening Program in 2017.
We've undertaken work on big-picture cancer projections, with our statistical modelling projecting 4.56 million new cancer cases and 1.45 million cancer deaths over the next 25 years. Now the Cancer PPP project is facilitating the refinement of our models to produce more detailed short-term model projections for each of the nominated streams. To demonstrate the level of detail we are producing, we'll now show you some of our Cancer PPP work in the area of lung cancer.
As you may know, epidemiological trends in lung cancer are driven in large part by the legacy of smoking. That's why we've developed the Australian Smoking History Simulator, which estimates historical trends in smoking behaviour in the Australian population and can predict future smoking prevalence. As part of the Cancer P project, we're upgrading the model to estimate patterns in smoking intensity. These will become an input for Policy One Lung, which models the natural history of lung cancer from pre-cancer, asymptomatic disease, diagnosis, and survival. Policy One Lung will generate estimates for lung cancer incidence and prevalence by spread of disease over the coming years. We'll also have forecasts for histological subtypes and molecular status using statistical models which incorporate information on patient demographics, smoking history, and genomic characteristics. Many changes are underway in the lung cancer policy space, and our goal is to have a comprehensive toolkit to address a wide range of questions. In addition to our work on patient population projections, our team has completed an evaluation of lung cancer screening, which will inform our modelling of the impact of a national screening program. We've also developed a model for lung cancer treatment to understand the economic and clinical implications of novel therapies.
As the finish line to the grant comes into sight, our team is exploring how we can best deliver our final projections in a way that is most valuable to the department. This web-based platform is an example of what the final output could look like, and how we can facilitate the dissemination of these findings more broadly. Note that the types of outputs we will be able to produce projections for, the number of years into the future that we will be able to project, as well as the level of detail that we will be able to provide on variables like age and sex, will vary for each tumour type.
Of course, this project is only possible with thanks to our broader investigator and study team who are working hard behind the scenes to produce these cancer projections.
Through the tailored projections delivered by these 3 projects, we will equip sponsors, the government, and relevant committees with new, independently generated data to inform future submissions and support evidence-based decision-making. Thank you very much for listening. My email address is listed if you have any questions on the Cancer Triple P project.